live program on Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patients to access the right treatment on right time. So let me first thank you all of you for joining us today as we observe No Tobacco Day, a significant occasion dedicated to raise awareness about the danger of tobacco and also the importance of quitting tobacco. So here I am honored to introduce our esteemed guest, Dr. Krishnamani, as a speaker for today's session, who has more than 10 years of experience. Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. Doctor, welcome to this No Tobacco Day live session.
Hello, everyone. Thank you so much. And As usual, we welcome everyone to Cancer Reach, which is a platform to spread awareness about cancer. And as you rightly said, today is World No Tobacco Day. May 31st is observed as World No Tobacco Day. So let's discuss something about that and what our efforts are on to combat this menace.
Thank you, Doctor. I hope, Doctor, today, whatever the valuable insights shared by you about the harmful effects of tobacco, quitting, benefits on quitting, practicing strategy will surely guide many of the people to at least quit tobacco, Doctor. So,
Yeah,
Doctor,
definitely.
just to start, Doctor, can you brief like how tobacco usage in India or which state is highly dependent on tobacco like that?
So first, what we have to understand is in what forms is tobacco used in our country. Okay. So we
Yes.
use tobacco either in the form of cigarettes, bidi, or
Uh,
chewable tobacco in the form of pan masala,
mm,
gutka, zarda, khaini, amber, all this. Okay. So the rich and affluent or the middle class will probably have a cigarette, or people may use pipe cigars or whatever you call. The people from the lower socioeconomic status may have chutta or bidi.
yes.
Okay. And then you have chewable tobacco. So these are all things. Tobacco, unfortunately, I have to use that word, is one thing which binds the country like alcohol. Because
Oh,
wherever you go, Kashmir to Kanyakumari, you will find a smoker. You will find somebody chewing pan masala or gutka, east, west, north, south. So there is no distinction like that. Yes, there could be a few states which where the incidence could be more, where the prevalence of people who smoke more in certain northern parts of the country or in certain areas. For example, you may have people chewing more tobacco, but
yes.
certain other areas you may have people smoking more BDs and cigarettes. But it is one thing which probably unites people across race, caste, creed, age, geography, and now even gender.
Oh,
By that I mean that a lot of women have also taken up to smoking. Not that women
yes.
weren't smoking earlier, women were smoking earlier. But now it is more glaring, it is more conspicuous. More urban, educated, working professional women are also taking to smoking cigarettes. And it is not a fad. It is not something they or the men can be proud of. As we have
Yes.
discussed earlier also, it is not that a gender should compare itself with another gender saying that you are doing this, so I am doing that. Definitely don't do it with smoking. If somebody is doing, let them go to hell. At least you don't smoke. And you try to convince them that they also do not smoke. So all these factors, all these ways, people across the country are some or the other hooked or addicted to some form of tobacco.
That's actually, Doctor, very sad to listen. Even if you see in one junction, instead of people gathering for something else, people are gathering for smoking or something, tobacco chewing kind of a thing. That's actually a very sad news that everybody
So you
are
have
addicted
go
to
to the
this kind.
airport, you have a smoking zone.
Yes.
Go to a mall, you may probably have a smoking zone designated. In the office, especially in corporate offices, in IT places, I think you have smoking zones. So in one way, okay, I think the reason they are probably keeping a designated space is that all the smokers go there and don't keep smoking in public and reduce the risk of secondhand smoke.
Yeah.
But aren't we promoting smoking in office spaces and in public places in an airport? So that is
Yeah.
my question. You are indirectly, by putting a smoking room, you're in fact generating the curiosity of a person who has just quit smoking or a non-smoker. So somebody who is a bit wavering will probably think, what is this? Let me indulge in this. Okay. I don't, I'm not very sure, but I don't think by any stands, any airports authority in the world will say you need to have a designated smoking area within the airport. I am
Okay.
not sure the legal part of it, but the moral part of it is, why do you even have to, if somebody has to quit, they have to quit. I know it is easier said than done. It is a very addictive kind of a disease. They need, we'll come to that, pharmacotherapy counseling, therapeutic treatment, behavioral therapy, psychotherapy and all that, but still. So and to add to that, the movies which we see, which literally
Yes.
legitimize smoking. So if the star has to walk in, he has to take a cigarette and he has to puff a lot of smoke around him, and that gives him that aura.
Yes.
So, so is a hero not a hero if he doesn't smoke, or he doesn't, what do you say, puff on screen? What we are doing is we are motivating a lot of youngsters in the wrong way. Many
Yes.
children will start picking the habit. Many people will start thinking that this is Macoism. Many
Yes.
children will think that this is, uh, so this is my hero and I want to be like him, and this is the way to be like him. The hero
Very
is
true.
not portraying hard work, sincerity, integrity in the film. Rather, this is an easy. So if you smoke a cigarette and puff out smoke, you are the hero. So a lot of young people will catch the habit because of this, because cinema is such a powerful medium.
Very true.
So that is the way in which tobacco is a part of our daily life, actually. Even though we don't smoke, you may not smoke, I may not smoke, but it's a part of your daily life because you see it in an ad, you see it in a song commercial, you see it in a movie,
Fighting.
you see in every. So, and obviously, you see people smoking around you. So that's the way it is.
And actually, doctor, you rightly said, we plan of putting no smoking zone or no smoking area and saying that we are providing the do not smoke, but indirectly we are helping them that okay, smoking is this area is there, go and smoke. So is with the movies. Even they highlight that smoking is injurious to health, but they indirectly show it, promote smoking is something hero or something. So it is indirect promotion happening that you can also smoke kind of a thing.
Off late, it has increased. I think last time also we spoke about it. Off late, it has increased a lot. In the last 2, 3 years, a lot of these movies, especially the South Indian movies,
Yes.
there is a lot of emphasis on the culture of smoking and a kind of a feel good factor. We don't know what it does to uh, young, impressionable minds. They may pick up the habit and they may never leave it.
Yes. And actually, sir, they generally any rebel star in South Indian movie or a superstar, they have they show it that they have a habit of smoking. So you rightly said the young generation tends to follow that. So, doctor, like in India, how more is the use of tobacco or any specific state? Can you elaborate more on those points, doctor?
So, see, to tell you, if you go on Wikipedia or if you go on any of the WHO websites, you will know.
Hmm.
In India, close to 270 million people smoke.
Oh my God. Okay.
270 million, what is our population? Our population is maybe
One.
1500 billion.
Yes.
So make it 300 billion, 300 by 5, so close to 20% of the population smokes. Okay, men and women both smoke. The
Hmm.
incidence of smoking in children is close to 15-20%.
Oh my God.
Okay,
Okay.
and these are all conservative estimates sometimes.
Hmm.
Okay, not every child who smokes gets reported or is part of the data collection.
Yes.
So it is extremely prevalent. And the funniest part is we are the second largest producer and the second largest consumer of tobacco in the world. Second largest producer is us only, second largest consumer is also we guys. And in that, close to 20% smokes. And in that, 20% of your kids, 15 to 20% of your kids smoke. And finally, the deaths, to 15 lakh deaths every year due to tobacco, directly linked to tobacco.
Can be any form, smoking or chewing tobacco, any
I'm just,
form.
I'm actually talking about smoking tobacco only. So 10 to
Oh,
15 lakh of your people are dying due to directly smoking tobacco. So that is how. So 20% of your population smokes, to 15 to 20% of your youngsters smoke, 10-15 lakh people are dying every year due to this. And we are the largest producer and consumer, second largest in the world.
In short, doctor, whatever the India is producing, it is consumed by India only. So it is like we are producing so that we can harm our own country
Harm.
or our own people, kind of a thing. So, doctor, is there any like majorly states you cannot say, oh, almost in all the states in India are equally like addicted to tobacco?
To be honest, I don't know the statistic, but in some places, like in Gujarat, for example, you have a ban on tobacco, so you cannot smoke.
But
You
eating is allowed.
tobacco chewing is allowed nonetheless. So, but as I said, it's a habit, and the habit exists all across the country. Wherever you have traveled, you would have seen people.
Yes, yes.
Hmm.
So, doctor, like like what will be the impact of non-cancer health effects because of this?
So now in Cancer Reach, we focus on cancer, but today being No Tobacco Day, we also wanted to emphasize on what are the other harmful effects. See, it can damage your lung. It can lead to chronic
Yes.
obstructive airway disease, we say.
Hmm.
Chronic obstructive airway disease means your lungs are damaged to such a level that you cannot breathe after some time. You'll get later, you'll be finding it difficult to breathe. Oxygen
Hmm.
levels in your blood will go down. This is not
Yes.
today. If you smoke for many years. In the heart, it can lead to blocks. It can lead to heart attacks. It can lead to stroke.
Hmm.
It can lead to blockage of the blood vessels in your leg, which is called peripheral arterial disease. Sometimes
Oh.
patients' legs maybe have to be amputated, cut also, because there is no blood supply in the leg, because you're chronically smoked and the blood vessels are all collapsed, or there is no blood flow.
Hmm.
So it can lead to early onset Alzheimer's.
Yes.
So from the brain, stroke, dementia, heart, blood vessels, lung. Okay. So smoking literally affects every part of the body, and there are non-cancerous effects also. And these non-cancerous effects are also, see, if you work in a night shift in a hospital, especially in a government hospital as a resident, you will know. You will have so many patients who come in the night with breathing difficulty who are smokers. We call it exacerbation of COPD. Exacerbation is it has increased. Their
Hmm.
COPD, which is there, suddenly it has increased. They become breathless in the night. They're unable to breathe. They come for oxygen in the hospital. They come for nebulization. Okay. So you will see that in hospitals very common, especially during winter months when already it is cold. They have that
Hmm.
breathing difficulty. So many of our patients who have stents, who needed bypass surgeries, who have had strokes, ask them the history. They will tell you they are smokers. So that is and what does it happen? You get a stroke, you're paralyzed. You cannot go to work. Okay,
Hmm.
dementia, early onset dementia. That's no good for you. You have a heart attack,
Yes.
leads to death or morbidity. Okay, your leg may be cut due to peripheral arterial disease. So all this has effect on health. It makes you morbid. You can die. Okay, people do die because of all this. We spoke about how 10-15 lakh people are dying due to tobacco. And
Yes.
it puts you out of a job, or you puts you out of an employment, or it makes you invalid, or you are unable to perform at the level where you're expected to perform. You spend so much on the habit and on the after effects of that and for
Treatment.
treatment.
Very true.
It is not. So it's like a continuous drain of resources. At the same time, you're not doing good to yourself.
Very true. It's like paying money to destroy yourself.
Destroy yourself. अपने पैर पे कुल्हाड़ी मारना, they say in Hindi.
Yes, very true, sir.
This is the non-cancerous part. And then you come to the cancerous part, which is one big list.
Yes. Actually, doctor, you won't believe many of my friends who smoke. We say that, why are you smoking? They say that even my father was smoking, he's still alive. He's 60 years old. He's 70 years old, but he's still doing very well. So they compare themselves to those people who are old and still smoking. So that comparison also sometimes seems very unlogical, but they compare themselves and they think that they can also live the life till that many years.
Yeah, so why do they take up the habit? One, they usually take it up at a very young age,
Yes.
impressionable. They see some of these people on the screen, they do it, or as you said, somebody in the family who does it, or peer
Hmm.
pressure, friends, a
Hmm.
gang of friends, they do it,
Yes,
or
very true.
the FOMO, fear of missing out. So because of that, they start the habit, or
Hmm.
stress, or the family structure is not very conducive. They're with the parents, they don't have a great relationship, or they stay in hostels, or they stay in foster homes. That is for the
Yes.
youngsters. Again, when
Yeah.
you take up smoking in an adult, again, it is because of your work stress or your general stress, your family, you have companions to smoke with you, so you pick up a habit.
Yes.
So that's
Yes.
the way it is.
But that's very sad to know the young generation how they're getting addicted to smoking.
Unfortunate,
Ye-
because once they start it, they are most of them don't leave the habit, and it carries on to adulthood and late adulthood, and then their health problems start after that.
Yes. This doctor, like in this journey, how now you told something about non-cancerous. You highlighted about cancer also. How tobacco and cancer is associated, doctor? Can you just
So
brief on it?
tobacco is responsible for around 30 to 40% of the cancers we see in India today. Number
Oh,
one. If there is one risk factor you want to reduce, and is one intervention with which you want to reduce the number of cases of cancer, it is stopping tobacco. You stop tobacco, significantly your cancer burden will come down. You see close to 15, 16 types of cancer with tobacco.
hmm.
Starts with head and neck cancer, lung cancer, bladder cancer, prostate cancer, cervical cancer, blood cancers, kidney
Hmm.
cancer. So throat, stomach cancer, esophagus cancers, larynx, literally anything and everything can be caused by tobacco. And it is responsible for a large burden, 20 to 30 to 40% of the cancer cases we see in our country.
Obviously, 20 to 30% people are addicted to cancer.
And the tobacco related cancers, what happens is you may have an oral cancer today, few years later, you may develop a lung cancer. You may be probably cured from lung cancer today, you may develop a kidney cancer or a bladder tumor if you survive beyond 4 or 5 years. Because your body has been exposed to tobacco. There is no rule that you should not get a second primary or second cancer again. And they're all related to tobacco, mind you. So that's the whole point.
Even doctor, when you were briefing on bladder cancer, we had a session previously on bladder cancer. Even the patient having a previous history of smoking also can end up having a bladder cancer after few years.
So the risk of cancer declines in former smokers maybe after
Hmm.
10 years only. And in some cancers like bladder cancer, it tends to persist even after 15, 20 years. That's what
Oh,
studies have shown. So let the young smokers not think that I will smoke for 10 years, 3 packets, 4 packets a day, and I'll stop it one fine day. First of all, stopping it is so difficult. Secondly,
yeah.
even if you stop it, there is no guarantee that this once you have stopped, everything is coming back to normal, because you have damaged your body enough. And there's
Yes.
still a risk of cancer. There is still a risk of cancer.
Sir, I in many of the India like states, like you told in Gujarat, how the smoking habit it is banned, but still you will find some places where you get these packets to smoke, and also they will even the drinking is banned. They will get some or the other options to drink also.
It's unfortunate, no? There's something
Yes,
they
very
they get it
unfortunate.
smuggled, they get it in the black market or whatever you call it.
So, doctor, how just like how will be the prognosis of tobacco related cancer?
See, imagine somebody has a cancer of the lung, but
Hmm.
he's a non-smoker.
Oh,
He's a
yes.
non-smoker. Non-smokers also get lung cancer. What is it? So, if you do a scan or whatever, the lung is a healthy lung. It has not been touched by tobacco at all.
Hmm.
Cancer is there in some part. Now, imagine the same cancer in a smoker. Cancer is also there, and you have destroyed the lungs by smoking, causing chronic obstructive pulmonary disease.
Hmm.
So, the prognosis is going to be poor. You have
Yes.
destroyed the lung, you have destroyed your heart. Okay, so your general health is not good, your fitness is not good, your immunity levels are not good.
Yes.
Okay, there is so what happens is in non-smokers, the prognosis is, see, if in a smoker, for example, if a smoker has to be taken up for surgery for a cancer, definitely his chances of recovery will be slower compared to a non-smoker,
Yes.
because there is less good blood, there is less oxygen in the body. because you have smoked so much. Your organs have been under a lot of stress due to smoking. You may be having obstructive airway disease. Your blood vessels are probably blocked. Okay, there are plaques we call that. They are plaques sitting in the blood vessels supplying the brain and the heart.
Hmm.
So your recovery from any major thing is going to be much more difficult than a hale and hearty non-smoking guy.
Yes,
So
very true.
definitely the prognosis post chemotherapy or post surgery or post radiation therapy, everything is going to be difficult.
Yes.
Imagine giving radiation to the lung in somebody who's already having obstructive airway disease. So the radiation oncologist will have to break his or her head because the lungs are already damaged by smoking, and radiation is essential for the treatment of this person. But if radiation touches the lung outside the field, then there is a chance of injury to that lung because of radiation also. So that's a double problem. Smoking has destroyed the lung. Now the radiation also may increase that lung injury. But in a non-smoker, the lung is perfectly fine. So even if little amount of radiation spills over to the lung and causes injury, the rest of the lungs are fine to take care.
Yes.
So the prognosis will definitely be poor in a chronic smoker. See, people who probably smoke one cigarette in a month, they are
Hmm.
like almost a never smoker. But you smoke
Okay.
a pack or two per day for 10 years, 15 years, 20 years, so you're going to be in trouble.
In fact, sir, never smoker category I rarely see here or there, because there is, I don't know whether the person who are already smoking can be a never smoker. They will be automatically increase the smoking capacity, or they will the increase of packs. It will be automatically increased slow by slow.
They will only qualify as former smokers if they quit smoking.
Okay. So, doctor, like, is there any, many people are addicted, but is there any chances, or is there any like prevention tobacco use or something which can guide the people to go with this kind of a line?
So the best
Prevention of
way is
tobacco.
sit and talk, counsel, tell them the harmful effects, and counsel them to quit the habit.
Um,
So I think they say, ask whether somebody is smoking, assess how much they smoke, advise them about the harmful effects, assist in quitting, okay, and refer to somebody who they can treat.
yes.
So
Fine.
5 A's or A and R, they say. So
Hmm.
the most important thing is have a conversation. Tell this guy or girl, see, it is a bad habit. It is bad even if you're rich, even if you're poor, if you're male, even if you're female, if you are urban or even if you're rural, if you're educated, if you're uneducated, none of that matters. The habit is bad. So quit. It causes all these issues. You're paying and getting problems, and you will pay a
Yes.
lot later, not only financially, but with your health also. You can get cancer, non-cancerous things, everything will trouble you. So educate them. Once you educate, and now due to the impact of social media, especially urbanization and the smartphones, many people know that it is harmful.
Hmm.
A conversation will probably add more value. They will probably take it more seriously. If not once, have a conversation again. Have a third time. If they volunteer, listen. If they have a difficulty, listen. Give them, what do you say, suggestions. And this is refer them to a good behavioral therapist if you do not have time. Finally, pharmacotherapy we call that is medications basically. So
Hmm.
nicotine patch, nicotine lozenges, nicotine gums. There is a medicine called varenicline.
Hmm.
So, so these are all your pharmacological methods to reduce smoking. And most importantly is having a very clear conversation about the harmful effects of tobacco. See, all the money we earn from tobacco, India loses close to 1.8 crore per year due to tobacco related expenditure on health, it seems. Just read it somewhere today or yesterday.
Oh my God. Huh.
So we are losing close to 1.8 crore rupees or 2 crore rupees due to tobacco related illnesses by health expenditure itself. So how can we even say that we earn a lot of money because of the tobacco industry? And even if we earn, are we justified by spoiling somebody's health, by them getting cancer, by their family coming to the streets, by them undergoing complex operations, disfiguring their face,
Yes.
disfiguring their body, becoming invalid, and living constantly in the fear of a recurrence of another cancer? Does it really justify? Does the sale of tobacco justify all this? No.
No.
So that is why we have to tell our patients there is no need to get a high by smoking tobacco. You can probably divert yourself. You can go for music therapy. You can sit and chat with friends. You can do something. You can do something different. Learn an art, learn a habit which you have long lost. Take your pet for a walk. Different things, some strategies so that at that time when you have that craving, you move away from that habit. This is what is needed. So basically,
Ac-
behavioral therapy and pharmacotherapy.
In US and outstate, there are many rehab centers or A group kind of a thing, which we see on movies and everything. How in India is that scenario available, or
I
it's
think
about?
so. Many of, for example, Nimhans, I think, has a rehab center. Many places, even the urban areas, you have
Mm,
rehab centers.
mm,
They're all there, but what also happens is many people relapse again after coming back from a rehab. So let us understand that this rehab thing and all is not a you go for 20 days and you come.
mm,
It's like a crash diet. You go for 20 days to some ashram, you have a crash diet. A man who's 90 kilos becomes 65, 70 kilos and who's looking hip and chick. And again, he goes back to work and is sedentary and eating burgers and samosas. And again, he comes back to it. That has to be a continuous process. So the
yes.
rehab has to be continuous. It should be ingrained in your mind that, see, I went somewhere to quit a habit and I will not pick up a habit after coming back to my natural environment.
So it should be the inner strength which a person should decide to quit tobacco, smoking, etc.
Tell them if you are a father smoking, tell them, see, you are smoking, your kids are also going to be affected because of you. So sometimes that tell a mom when tell a woman when she's pregnant and smoking, see, you're bearing a child and the child is going to be born with birth defects tomorrow because of you. Sometimes I feel you have to put that sense of guilt in them because of their habit, others are going to be affected. If that
Yes.
helps them to quit, wonderful.
It is like emotionally blackmailing.
Yes. This is not blackmailing also. This is right and facts are in front of them.
Yes.
If a woman smokes during pregnancy, her child will be stillborn. The child will have birth defects. The child will be a premature baby. These are all very low birth weight. They're very well known. Show that woman, you have no right to kill a child, right? You only have
Yes.
a right to give birth. Same way, this guy who is smoking at home, tell him, second-hand smoke, passive smoke, your child, your daughter or son can develop lung cancer. You're singularly responsible.
Yes. Not only like cancer, but also if you also have a cancer, the money crisis or the family management crisis will affect so badly to the other family members as well. But something, doctor, it is even though they are aware of everything, but that inner strength is somewhere really missing among many of the smokers or the tobacco addicted people.
Not only, yeah, it's a part of the society also now. We are four people sitting in the same house, but we four people will be watching the mobile and not talk to each other.
Very true.
20 years
Very true.
earlier, it was not like this. 40 people can
Yes.
also have a conversation and laugh.
Yes.
So that if see when you're talking to people, when you're in a group, okay, when you're involving, when you're having conversations, then what happens is all these kind of things go back.
Yes.
It's only because you are drawn alone, you are in your own world, that sometimes these kind of cravings take precedence.
Yes. Very
That is
true.
important.
In
That's why
fact, sir,
our
hmm,
family system is very important. Our family system is a nucleus which actually helps in a country like us.
sir, like you told, no, at least in India, some of the family bonding is still there. Somewhere in the other way. So if a right sense comes to the person, then really it can be saved, or the tobacco habit can be quit.
Definitely.
So, doctor, like because of all this, how economic burden is there due to tobacco use?
Tremendous. No, we say we are losing 10, 15 lakh people due to tobacco. We are losing close
Yes.
to 2 crore rupees every year due to tobacco and to expenditure on health. So
Mhm.
imagine, and as we said, there's so much. See, you spend on the habit, you spend on de-addiction, you spend on health-related complications. Imagine, for an example, you have
Hmm.
you smoke and you develop a lung cancer. You
Yes.
come with
Okay.
stage 4 lung cancer. Let us imagine somebody comes with stage 4 lung cancer. That fellow, stage 4 lung cancer, for chemotherapy alone, he will have to spend close to 25,000 per month per cycle.
Yes.
If you are going to give immunotherapy, that is 2 lakhs per cycle, indefinite, at least for 2 years. And again, it will relapse. It has gone to the brain, give radiation to the brain, at least minimum 50,000. You have stage 2 lung cancer, you want to operate it. Minimum in urban cities, in urban hospitals nowadays, it is 4 to 5 lakhs. So this is not at all a cheap affair. Your one packet of cigarette can cause so much uh, hardship to everybody, financially also, physically, emotionally, mentally. And for you, there is somebody who has to leave their job and be behind you in the hospital.
Yes.
Okay. So, and after this, when you come out of the hospital, many of the things are not covered under insurance. So you have to pay from your pocket. You have to pay from your pocket for physiotherapy. You have to pay from your pocket for oxygen. You have to pay from your pocket for a lot of other things, rehabilitation and all that. So not everything, just because things come under insurance, oh, it's okay, I'm covered, so nothing is going to happen. I'm not spending from my pocket. No, you're only spending because anyway your premium will go up the next year around.
Yes.
So mm, I just gave you an example of lung cancer. So any cancer treatment costs are in lakhs nowadays. And if it is advanced disease, they're going to relapse and you're going to spend again and again and again and again. And at the end of the time, end of the day, it anyway, any which way affects your health. So the economic burden is tremendous. Lot of out-of-pocket expenditure, we say. For your sake, your family has to run around. Scans, investigation, blood investigations, surgery, radiation, chemotherapy, immunotherapy, whatnot.
So it's like, I should not say, but it's like along with the cigarette, some GST is confirmed. So these are the drawbacks which will be compulsory attached. And apart from that, pain in which the patient itself will be suffering during the treatment. I have seen the smoking is not so enjoyable. After they smoke, they cough like for 1 to 2 hours because of, I don't, that congestion or
Correct.
obstructive behavior. They will continuously cough. They will have some ulcers inside the mouth. They won't be able to, even though they are not having cancer, but because of smoking, these are
Yeah,
many of the,
very true, very true.
but then
Actually,
also they doesn't plan to quit. I don't know why.
it is not, that's why it is in no way is it a pleasurable habit. Number one. Number two, no way is it an industry which is, I would say, economically or financially sound. Because even if it is making money for you, it is killing your nation's young people and it is making you bleed uh, close to 2 lakh crore every year. Where is it? Where does it make financial sense? Even if that is the reason for the sale of tobacco in our country.
Just imagine if that money is converted in some good development or a good deeds, where it will reach.
Correct. So imagine the health of the country, imagine the workforce of the country.
Exactly. Still, the people go for something which is addictive than something which will be good for their health.
Correct.
Actually, doctor, is really very sad to see destroying their own life with their own wish and with their own habit.
So again, I would emphasize there's a singularly one habit which, if as a society we can remove from a cancer point of view, we will do really good.
Actually, in fact, sir, on the no tobacco day also, I can 100% assure that the people who are really smokers, they will ensure that they do that kind of activity on the no tobacco day. Like smoking, we will ensure that we will smoke today like that. Some other, it's like instead of going on a positive track, they go in a negative track and they ensure that that is happen.
But if somebody listens to us today and they understand what we are saying, then I'll be very happy even if one person quits.
Same here, doctor.
Fingers
So, doctor,
crossed.
actually, there are many things to learn on this, but by this we have just came to the end of the session. But still, doctor, tobacco the No Tobacco Awareness Day should be 365 days, not
Correct.
like.
It's not a one-day affair. Yeah.
So, doctor, would you like to give some closing statement to this No Tobacco Day session?
Yeah. So as you said, it is not just 31st May. It is 365 days, number one.
Yes.
And the one habit which has to be kicked out of the country is tobacco, especially from cancer point of view. No two things about it, including oral tobacco, that is chewable tobacco. We cannot afford tobacco-related cancers. We can reduce our burden by maybe 20% or 30%. Two. Three, adults should set an example. Do not smoke in front of children. Do not smoke in public places.
Yes.
And adults try to quit smoking. There are beautiful, what do you say, support groups available. So please enroll in your every city. There will be one for sure. There will be toll-free numbers. They'll counsel you to stop smoking. You're not alone. You can quit. And kids do not take up this habit. Hookah, smoking, vaping, e-cigarettes. No, it is not for kids. It's not for anybody. There's a lot of news that kids in school have been caught with e-cigarettes in their bag and all that. That is not at all a healthy trend. It is not a stylish trend also. So the only one sentence will be, let's quit tobacco. And by that, we should stop cancer.
And doctor, just to add, that trendy what the movie people show, that hero and everybody come smoking, but in their real life, they are not smoker. They come as a category of a non-smoker or a never smoker kind of a category. But they show it on a screen that we smoke a lot.
Yeah.
And that is what our people follow. Instead of their real life, they are non-smokers.
True.
Thank you, doctor. Thank you very much for this wonderful and valuable message, doctor. I hope everybody, whoever is watching this video, a special and a pleasing request is to please stop tobacco. So thank you, doctor, very much. Thank you, everybody, for watching. Apart from that, wishing you all strength, hope, and good health from Cancer Ridge.
Thank you so much. Bye.
Thank you, doctor. Thanks a lot.